Introduction to Healthcare and Receptionists. Introduction to the module. Medical receptionists need to have good knowledge of healthcare service and their role. In this module, you will learn about healthcare and what are the responsibilities and required skills of a medical receptionist. Topics to be covered are: Introduction to healthcare. Who are receptionists? Medical receptionists in the United Kingdom. Responsibilities of medical receptionists. Skills required for good receptionists. Introduction to healthcare. A healthcare system can be defined as the system by which healthcare services for a population is financed, organized, and delivered. It includes access issues, for whom and to which services, expenditures, and resources, healthcare personnel and facilities. A healthcare system's goal is to enhance the population's health in the most effective manner possible, with keeping a balance between available resources and competing needs of a specific society. By the beginning of the 21st century, access to healthcare had come to be regarded by most countries and the United Nations as a special good that is necessary either as a matter of, or according to basic human rights. An examination of healthcare systems, therefore, includes considering how a particular system addresses commonly held values. Various factors, including the unique culture and history of a population or country, influences the extent and form of a specific healthcare system. The consideration of standard healthcare can vary markedly in accordance with a country's level of development, culture, and social values. Some populations emphasize the prevention of disease, whereas others emphasize only the care for or cure of particular illnesses. The priorities given to various ethical values are the second major influence on the healthcare system of a population. The level of economic resources available is the third influence on the structure of a healthcare system. There is a strong positive correlation between economic resources, measured by the per capita gross domestic product, GDP, and both healthcare expenditures and the proportion of a nation's GDP spent on healthcare. The National Health System, NHS, is a publicly funded healthcare system in the UK. The NHS is different from many healthcare systems found in different developed countries, as it is funded not through health insurance, but by taxation. The people can also choose smaller private healthcare sectors if they wish. There are different NHS bodies for each region of the UK. We will focus mainly on England's service, but you can find more information about services in other regions on NHS Scotland, NHS Wales, and NHS Northern Ireland. The differences between the regional health services are mainly structural, and how some of the services are delivered. The Department of Health oversees the NHS in England. It is the NHS's responsibility for commissioning primary care services such as doctors, dentists, and pharmacists. Since 2013, clinical commissioning groups, CCG, have had the responsibility of commissioning secondary care services in local areas, which are planned hospital care, rehabilitative care, urgent and emergency care, most community health services, mental health and learning disability services. Over the years, there have been many structural changes to the NHS. In recent years, many private companies and charities have become more involved in running services. All services are publicly funded, and the government is ultimately accountable, although, in reality, it is more of a public-private partnership in terms of delivery. Who are receptionists? Medical receptionists, sometimes called medical administrative assistants, unit secretaries or patient coordinators, are administrative professionals within a healthcare setting. Medical receptionists interact with patients or customers when they schedule an appointment, make billing inquiries, or come into a hospital, clinic, or laboratory for an appointment. Unlike a receptionist in a traditional office, medical receptionists have extensive knowledge of medical terminology and healthcare procedures. They are responsible for an essential link between the healthcare infrastructure, providers, and the people seeking medical care. Medical secretaries and receptionists are important and sometimes undervalued members of the healthcare team. Usually, they are the first point of contact that the patient has with a medical practice or a hospital department, clinic, or ward. The receptionist's attitude, empathy, and efficiency are able either to enhance or to damage their image. A good receptionist can facilitate how a patient accesses the system of medical care and should do all that is possible to make the patient feel welcome and comfortable and ease their access to medical help and care. The first impression that a patient has of the surgery or hospital department is usually of the reception area and the reception staff. Remember that the receptionist is the shop window, and the way in which patients feel as they sit in the waiting area will largely depend on how the receptionist has reacted to and greeted them. It is the receptionist's role to allay patients' fears and worries and help them to feel comfortable whilst they wait. A courteous, friendly manner, accompanied by a smile and an understanding of the situation, can work wonders even with the most difficult patients. Medical receptionists in the United Kingdom. There are more than 2 million people employed in the UK health sector. Opportunities are available across the UK. And due to the pandemic, the opportunity for healthcare employees has increased a lot. The NHS is the largest employer, where medical receptionists are employed in GP practices, out-of-hours centres, health centres, hospitals. Opportunities are also available within the independent sector, including private hospitals and voluntary organisations. Job vacancies are frequently posted in local newspapers, job centres, offices, and NHS websites. There are no formal entry requirements for becoming a medical receptionist, but employers may ask for 5 GCSEs, a star, to C, which includes English and maths. The diplomas in society, health and development, or business, administration and finance may be relevant for this area of work. There are a number of nationally accredited Level 2 qualifications that may be suitable for people aiming to become medical receptionists, including the Association of Medical Secretaries, Practice Managers, Administrators, and Receptionists, AMSPA, Intermediate Diploma in Medical Reception. AMSPA Level 2 Certificate in Medical Terminology for Non-Clinical Professionals. City and Guilds Level 2 Intermediate Diploma for Medical Reception. Edexcel Level 2 NVQ in Support Services in Healthcare. The average medical receptionist salary in the United Kingdom is £17,550 per year or £9 per hour. Entry-level positions start at £16,010 per year, while most experienced workers make up to £20,573 per year. Responsibilities of medical receptionists. The medical receptionist's responsibilities include answering incoming calls, directing calls to suitable staff, welcoming and checking all patients for office appointments, including filling out patient paperwork, scanning insurance cards, entering all demographic details into the electronic health record, entering office visit referrals, scanning staff as needed, and working closely with doctors and staff. The common responsibilities of medical receptionists may be listed as serving patients by greeting and helping them, scheduling appointments, and maintaining records and accounts. Welcoming patients and visitors in person or on the telephone and answering or referring inquiries. Optimizing patient satisfaction, provider time, and treatment room utilization by scheduling appointments in person or by telephone. Keeping patient appointments on schedule by notifying the patient's arrival to the provider, reviewing service delivery compared to schedule, and reminding providers of service delays. Comforting patients by anticipating patients' anxieties, answering patients' queries, and maintaining the reception area. Filing and retrieving patient records to ensure the availability of treatment information. Obtaining, recording, and updating personal and financial information to maintain patient accounts. Recording and updating financial information, recording and collecting patient charges, controlling credit extended to patients, and filing, collecting and expediting third-party claims to obtain revenue. Maintaining inventory and equipment for business offices by inspecting stock to assess inventory level, forecasting supplies required, placing and expediting supply orders, confirming receipt of supplies, and scheduling service and repair of equipment. Helping patients in distress by responding to emergencies. Maintaining the confidentiality of medical, personal, and financial information to protect patients' rights. Following policies and procedures, reporting needed changes to maintain operations. Contributing to team effort by accomplishing related results as needed. Skills required for good receptionists. The top skills that good medical receptionists need to succeed in their career include the following: customer service skills. Attending to patients and clients is one of the medical receptionist duties as front desk personnel. It requires excellent customer service knowledge to render services to clients in a professional manner. Interpersonal skills. The ability to interact with people on a one-on-one basis helps to get the job done. The receptionist will be able to relate with clients effortlessly, with the help of interpersonal skills. Communication skills. For one whose job is people-oriented, the need for excellent communication skills goes without saying, as it creates a free flow of giving and receiving information, and fosters understanding. Multitasking skills. There can be a lot of stuff on the desk at a given time in the medical work environment, which requires attention. Instead of being distracted, to get more tasks finished and keep the office running smoothly, the receptionist will need to find a way to handle several tasks simultaneously. Prioritizing. There's just so much one person can do at a time, and the receptionist in a medical facility must be able to understand this. Otherwise, he or she may leave out important tasks undone, which could cause serious dislocation to the activities of the office. Organizational skills. It is important to keep things in check in order to maintain orderliness in the clinic. While there are several duties to be accomplished, the receptionist must ensure that the reception area is well organized and just not overcrowded while they direct patients and customers, while arranging it out to maintain a queue. Technical skills. The receptionist must be able to handle such electronic devices that are used at work, such as telephones and computers. Computer skills. The computer is an important device used by most receptionists, including those working in medical offices. Therefore, the receptionist must be able to operate basic computer software programs like Microsoft Word, Excel, and Outlook. Problem-solving skills. One of a medical receptionist's major responsibilities is to attend to inquiries and complaints from patients and visitors regarding the services in the clinic. Dependability. While working with doctors and other medical personnel, the receptionist must be diligent in making available all necessary documents and files, as at when needed, thereby making the job of the doctor easier. Time management skills. It is important to be as fast, while attending to patients and processing their documents, to see the doctor as possible in order, not to keep them waiting for too long. Record keeping. As part of clinic procedures, the receptionist must be able to collect patients' information for record keeping and future reference effectively. Working under pressure. The job of the receptionist in a medical office with lots of patients to attend to and documents to process for doctors' use can be overwhelming sometimes. Attention to detail. Working with medical professionals requires listening to procedural orders and obeying them to the letter to prevent errors or mistakes. Anger management skills. Dealing with different kinds of people on a daily basis, some of whom may prove difficult, requires the receptionist to stay calm in the face of pressing situations. Summary. In this module, you have learned: a healthcare system can be defined as the system by which healthcare services for a population is financed, organized, and delivered. Various factors, including the unique culture and history of a population or country, influences the extent and form of a specific healthcare system. The NHS is different from many healthcare systems found in different developed countries, as it is funded not through health insurance, but by taxation. There are more than 2 million people employed in the UK health sector. Opportunities are available across the UK. And due to the pandemic, the opportunity for healthcare employees has increased a lot. The average medical receptionist salary in the United Kingdom is £17,550 per year or £9 per hour. Entry-level positions start at £16,010 per year, while most experienced workers make up to £20,573 per year. The ability to interact with people on a one-on-one basis helps to get the job done.